Every July, hundreds of doctors, dentists, optometrists, and nurses converge on the small Appalachian town of Wise, Virginia. With the help of a huge contingent of volunteers, they transform the county fairgrounds into a sprawling outdoor medical clinic. In just 2.5 days, the team provides free treatment to more than 2,500 people.
There's really no difference between the people that we're seeing here at one of these rural events or the people that we're seeing in a metropolitan area. They've got the same kinds of problems. They simply cannot afford to go to the dentist. They cannot afford to go to the eye doctor. But they also all have the other problems for which they really need to see a medical doctor. There are people that have problems with their weight. There are people that have problems with hypertension. There are people that have problems because they're smoking. Although when they, fall down, break their arm, they can go to an emergency room and get it taken care of, there needs to be universal health care that must include dentistry. It must include vision care for that segment of the population who are not going to be able to afford it. This is going to be our 544th medical expedition and the 9th one that we've held here in Wise County.
I think this project is a perfect example of that collaboration between medicine and dentistry, and it allows us to collaboratively work together to make communities healthier.
What you're going to see here is not rocket science. It's ridiculously simple. It just takes a lot of people.
Okay, we're here to present a donation of $5,000 to Stan Brock to help assist the remote area medical assistance plan because of everything they do for this region and everything they do for people all over the United States.
So it's not just for Katrina. If you've got a mouthful of bad teeth, and you're going to see some horrendous cases here this weekend, if you've got a mouthful of bad teeth and it's seriously affecting your health and your ability to look after your family, it is, in fact, for you, a disaster, right? Just as bad as it has been for some of those unfortunate people in, that had a tornado go through the town.
We're here for the health fair. Definitely.
Yes. And are you volunteers or you're actually patients?
We're patients. We're going to see the dentist and the eye exam.
Mammogram.
We don't have the health insurance or the money to be able to afford to go to the doctor.
Yeah.
So this is what we have. Unfortunately.
Oh.
Well, really, we're here to get earlier. A ticket. Well, we would have been here earlier, but they told us they weren't pre-registering, but they were. So we are here to get a ticket, so we won't be 1,178 tomorrow.
Yeah.
Because they'll cut it off, and only so many people can get in tomorrow.
Once people get in line for dental and vision, they won't leave.
Well, we don't have any jobs. We don't have no insurance. We have a low minimum wage, and everything is going high. So, so you pay your bills or you go to see the dentist. What do you do?
When it's absolutely
necessary. Yeah.
To me, it's all about service. It's all about, if you want purpose and meaning in your life, then give some service back.
We were helping out, volunteering on people's teeth. It's tomorrow, the next day, and Sunday is the last day. So I'm just trying to help out, do whatever I can.
What are you going to do?
Assist, hopefully it's assistant dentist.
This is actually my first time, so I'm really excited to be here. And we're here until Sunday. I think we do all kinds of work until Sunday afternoon, right before we pack up and then come out. So
remote area medical volunteers don't get tired, right, Jim? Yes.
And things of this nature, especially with the 47 million people that are either not insured or underinsured in the United States, actually is probably one of the best things going. It's my understanding all of it's volunteer, and we wanted to help do our part to keep it going.
Sorry, tickets here. I'm here looking for you. What is your name, Mike? It's a pleasure, Mr. Woodell. Thank you. We have chased you down.
I want to shake his hand too.
What we got right here is I got the tickets. We already had 146 pre-registered. We should registration off at 6 o'clock. Now tomorrow, we need to be here at 5. No later than 5:25, 5:30. 5:30, we're going to start calling numbers in. If you ain't here, you have to go back to line.
Okay, gotcha.
Got it?
Thank you. Thank you. You take care.
I'm going to have to send a lot of people away here, and it's just a fact of life. And the problem there is that we're not coming back for maybe a long time, right?
For some people, this is the only health care that they get on an annual basis.
The night before the clinic opens, hundreds of people camp out to be sure that they can get one of the 1,500 admission tickets that are given out just before dawn. By 6 a.m., all the tickets for that day have been distributed, and organizers are starting to triage patients. Hear their stories in our next segment.